Hello, friends. A very good afternoon. So, I welcome you all to Khadela Academy, where we are trying to reach to all the students in order to impart the education, whether it is in terms of medical education or medical student can also take advantage. Pharm.D student, doctor of pharmacy student in India or all across the globe can take advantage of the scientific content or the medical videos about all the disease we are posting on this channel. And all the pharmacy student and the life science student also can take the advantage of this channel. This channel is basically created to impart the education to all the people who cannot maybe because of finance or because of time cannot able to get the education on time. So this session basically we have planned for the interaction with the participant or the viewers who are watching our videos, and maybe when the video has been posted on the YouTube, it is one side video where we talk about pathophysiology or maybe management side or maybe basic concept of some disease, but we cannot take the questions or we cannot ask our viewers whether they have understood the concept appropriately or not. So we will be continuously arranging this kind of ask me anything about the recently posted video session where you can ask us what is your queries. So we will try to explain, I will try to explain every queries raised by the participant maximum when it is possible, and we can use different regional languages to explain and impart the knowledge more precisely. So we already circulated one uh, poll where we have asked people about question answer session. We got very good response, and in response to that, we have arranged this session. Maybe some of the people cannot able to join this YouTube live session because of some urgent or emergency commitments or priorities. We will be keeping this live session for 7 days. So within the 7 days, you can come and you can visit our channel and you can watch this live session. We have already asked for the questions and we have some set of questions which we will be discussing one by one. So meanwhile, if you still have any doubt, you can tell us your view by commenting in the live chat box. So we'll take it and we will discuss it more in detail. So basically, if you still new for to this channel, please subscribe and help us to reach to the maximum people who are at need, who are underprivileged, who are deprived of education because of some strain like financial constraint or time which is not feasible for them. So this is why we are helping them or we are reaching out to those people, and we wish to impart a very good knowledge to them, and we wish them to progress in their uh, respective careers. So starting with our first question, which we have gathered during the last 2 days. Question was from Vidisha. She asked us about, can you explain more about opportunities of Pharm.D in clinical fellowships? So I can understand that this question is based on our first video, scope of Pharm.D in India. So let me help you with this doubt. Basically, clinical fellowships are those kind of job opportunities where you required some sort of specialized knowledge. I have given an example of Tata Memorial Center, and which is located in Mumbai, where every year they are asking MD as well as PharmD graduate to apply, and they are conducting a multiple choice question preliminary screening exam, and after you clear that exam, you will be eligible for the personal interview. And once you clear the interview, you will get the opportunity to work with the Tata Memorial Cancer Institute in Mumbai, where they will provide you subsidized accommodation as well as a hefty stipend. And after completion of your 1 or 2 year of clinical fellowships, if your work is good, you can continue your journey in that Tata Memorial Center as a full-time employee. Likewise, there are various clinical fellowships offered by the nephrology department where you can precisely give your inputs in terms of maintaining the dose of various regimen or drugs in those patients who are having compromised renal function. We talk about clinical fellowships in cardiology, where there is a precise selection of antihypertensive or cardiotonic agents in many different cardiovascular conditions like acute coronary syndrome, ischemic heart disease, and other cardiovascular consequences. Clinical fellowships in oncology, where you can contribute to different cancer, and clinical fellowships also in intensive care units and emergency medicine, emergency department, where also you can actively participate and you can actively apply. In India, if I talk about clinical fellowships opportunity, the most popular opportunity we already discussed in our video, that is about Tata Memorial Cancer Institute in Mumbai. They are asking for the application every year. You can visit the website, the link and the detail. You can ask us via email, so we can provide you. We have also mentioned the details in our first video where we have discussed about the clinical fellowships. You can specifically see that part. We have divided our video in different parts so that you don't have to watch it again fully. You can precisely watch that part and you can uh, understand that what kind of opportunity it is and how you can apply. Still you have doubt, you can connect to us or you can write in chat box. We will discuss specific what kind of doubt or what kind of problems you are facing. Many people have asked me about the syllabus of that exam, Tata Memorial Cancer Institute. There is no defined syllabus. You cannot find syllabus on the website. You just have to have thorough knowledge of clinical oncology as well as clinical research. So you should know about various malignancy, solid tumor, liquid tumor, staging, prognosis, different regimens prescribed, and you should have some knowledge in clinical research where you know how to start clinical trial, what is informed consent form, what is case report form, different kind of things like that. So this is how I hope Vidhi you can understand and you can take some of the learning out of this discussion. Then next we have a question from Jai Nagpura, and his question is about: is there any current clinical projects ongoing for Pharm.D graduates to enroll? Now I still have some doubt, Jai, that what you are asking basically, that what are clinical projects you are talking about. Basically, in project based opportunity, when I discussed in our first video, I was discussing about ICMR funded project. I was discussing about the National Institute of Virology funded project, then NARI, NARI, National AIDS Research Institute funded project. So in this kind of project, if you ask, you can get the details from the ICMR website, you can get the details from National Institute of Virology website, you can get the detail from NARI website, which is dedicated to AIDS related research. You can go to that platform and you can see whether there is a ongoing project and still they are recruiting. And as I said in the video also, CSIR, UGC CSIR net is mandatory exam in order to through to this project based opportunity, because for BPharm student they are appearing for GPAT examination, which is conducted all which is conducted at the national level. But for Pharm.D there is no specific exam, there is no specific exam after completion of Pharm.D. We will be soon launching information related to competitive exam which Pharm.D graduates can appear. That video we will be launching in future so that you will get an idea. But right now, to answer your query, you need to first clear the CSIR, UGC CSIR net, or you can also think of appear for the GPET, not for the purpose of taking admission in the master, but you can also enroll and you can appear for the GPET. If you qualify the GPET, you will be eligible to enroll in such project based opportunity if you clear the interview. The condition is you have to clear the interview along with the exam. You cannot just clear the exam and you will get an opportunity. This is very competitive opportunity because many people will apply for this condition, this position, and this is very competitive in nature. So you have to have thorough knowledge to that particular project. It is a project based opportunity. So if you are applying for a clinic, if opportunity is in ICMR funded oncology project, you should have a thorough knowledge in oncology. Then only you will get an idea. You will then only you will you will be able to clear the exam, as well as you will be able to clear the interview. And this is very highly paid job. Let me tell you, for the junior research fellow, the salary is around, in a metro city, salary is around 39,000 per month, which is very high. Along with that, you can also enroll for the PhD. So you will get fund, you will be junior research fellow, that will be accolade you will be getting. Moreover, you can also register for the PhD. In 3 years, if you will be junior research fellow, you will be getting this much hefty stipend, and you can complete your PhD, and you can publish your work, and you can also write in your resume that you have been doing PhD, you have done PhD with the funded project. It will have a very good impact. So this is my answer for the question raised by the Jai Nagpura. Then I have a question from Mohit Sharma, where he's asking about, is there any certificate course required for medical coding? Well, if you are a Pharm.D graduate, I don't think that any specific certificate course you have to uh, have, or you have to appear for any certificate course in order to enroll for the medical coding, because MEDRA, which is medical terminologies for adverse drug reaction monitoring and adverse event monitoring, which is taught in both master's level, also in pharmacovigilance, clinical research and pharmacovigilance subject. Those who are enrolled in M.Pharm pharmacology, those who are enrolled in M.Pharm pharmacy practice, those who are enrolled in M.Pharm clinical pharmacy, and it is also covered in Pharm.D syllabus. This medical terminologies. That terminologies will help you in medical coding. Moreover, when you join any medical coding institute or industry or any clinical organization, they will also provide training to the software what you are going to handle, and to the terminologies what you are going to use. So I don't think that any specific certificate course is required in order to get the job in medical coding field. Why I'm emphasizing more that it is nowadays a myth spreaded in all the youngsters mind, that even after they are enrolled in Pharm.D, even after they are paying very high fees in Pharm.D institutes where they are enrolled for, still they are also spending some money in attending such kind of certificate courses, where the applicability of these courses and certificate is very limited. So I believe that you get the best education from the Pharm.D syllabus itself, and try to indulge in those certificate courses which is not covered in the syllabus by the PCI, Pharmacy Council of India. It will be very helpful to you to add knowledge which is apart from the Pharm.D field and related to Pharm.D, which will extend the knowledge, rather than taking the knowledge which is already covered in Pharmacy Council of India designed syllabus of Pharm.D, and then you are going out to attend the new certificate course of the same topic which you will be studying or you have studied in the Pharm.D, will not have any impact when you appear for the job. We will also have some live sessions on what kind of courses you need to select while you are while you are doing your Pharm.D, and we will discuss thoroughly on this topic also. But I believe that for medical coding you don't require any certificate course, and there are many certificate courses run by the many pharmacy colleges as well as some medical colleges. But I don't believe that for Pharm.D graduate, M.Pharm pharmacy practice, clinical pharmacy, or M.Pharm pharmacology has have to appear for any specific certificate course for the medical coding. Next, we have one query from, I must say that, or I must acknowledge the student Syed Hussein. He is an international student. He has asked query through email, and he has asked that he want to appear for the international graduate, wanting to appear for the January 2024 evaluating exam I have watched your YouTube content regarding PEBC and found it very useful. Thank you so much for the compliment. I want to ask you a few questions like what is the current PEBC syllabus and what are the recommended books to start preparing for PEBC. Now, maybe many people will be asking this question. Let me first clearly give you an idea that you will get the PEBC syllabus from the PEBC website, which we have also shown in our video, where you can get the syllabus, full syllabus. We also discuss about the bifurcation of the syllabus in our video in detail, that what are the components of the syllabus. Apart from that, I must say that the if you have many people are attending the PEBC classes run by the many private institute, but I must say that again, Pharm.D syllabus is replica of a PEBC syllabus. Pharmacy practice is 50% weightage in the PEBC syllabus. So if you have a very good understanding of Pharm.D therapeutics, which is the main subject in Pharm.D, along with the pharmacology and other kinetics like subject, if you have a thorough understanding of these topics, then you don't have to specifically attend the classes of PEBC, which where also they will be teaching you the same content. We are trying here by putting, see, we have posted so many videos on disease now, and we will be posting so many videos on disease that if you are studying hypertension precisely, that hypertension is also part of syllabus of PEBC. And when you appear for PEBC, you will getting questions from the content what we will be teaching in PharmD student, what we will be teaching to PharmD student or MPharm pharmacy practice student. So you don't have to specifically prepare for PEBC apart from your syllabus. Advantage of PharmD student and MPharm pharmacy practice or clinical pharmacy or MPharm pharmacology student is that you have a very good knowledge of clinical background, and that knowledge will help you to clear the PEBC. You just have to read the jurisprudence. You just have to read the law, where you will be appearing, where which province you will be selecting, what kind of laws in a country where you will be going. Like PEBC is conducted in Canada, what is the Canadian rule? You have to just learn about those jurisprudence books, which will give you idea about Canadian rules. You don't have to attend specific classes for this kind of therapeutics content. So this is what I wanted to convey to you, Sayed. And you asked me for the books. You can use good books like Harfindal. Harfindal is a textbook you for the therapeutics. You can use Koda Kimball. You can use DPRO. These are the books I'm recommending for pharmacy practice. You can use several books which is covered in which is mentioned in the PCI syllabus in Sutics for pharmaceutics, some content of pharmaceutics, because you need to calculate the dose. So pharmaceutical calculation is the topic covered in the pharmaceutics subject in PharmD. So you will get that knowledge also from pharmaceutics books or pharmaceutics which is covered in the PharmD. You required some information related to pharmacology, which is given in KD Tripathi. Like it is a very good book for pharmacology. So I recommend Harfindal, Koda Kimball, KD Tripathi, some very good books of Sutics and some books of medicinal chemistry, FOA, and all. You can refer it. There is no specific book for PEBC. You want to study on one content, and that content is given in some book. You can refer that book. I hope I must say that there is no specific book for PEBC. You don't ask that question. You ask what specific, like if you have any doubt to specific topic, that this topic I'm not getting from a book, then I'll help you to suggest that this topic is given in this book. Say, for example, hypertension is precisely given in Arfindal. So I must recommend that you refer Arfindal, excuse me, for the hypertension related concept if you are facing some doubt. And you asked me that where will you find the books. The books are available online. You are international student, so I cannot give you a local merchant or book seller address. You can use Amazon, Flipkart, like online platform to buy these books. It will be available online, all the books. Then we have a question from Kiran Lalpara. Good afternoon, sir. Can you explain afterload and preload in detail? So thank you, Kiran, for your query. Preload and afterload we had discussed in the basic fundamental concept of blood pressure and in the first video of hypertension. Many people are facing doubt while they are encountering with the preload and afterload concept. Let me precisely explain. First preload I'll explain and then afterload. Preload is end diastolic volume. Now, basically, we need to clearly understand two concepts that our heart, in our fourth chamber of heart, left ventricle is pushing the blood to the whole body, and the right side of the heart system, right atrium and right ventricle, is collecting the blood from whole body. We discussed that when we are pushing the blood from the left ventricle to the whole body, we require high pressure. In order to generate that pressure, Frank Starling has given a law that when the left ventricle or heart is filled with more blood, the force of contraction will also increase. So the filling and force of contraction are directly proportional. When filling and contraction is directly proportional, when heart is filled with more blood, it will fill with more force and it will push more blood to the systemic circulation and then blood pressure may rise. Now, what is preload? The preload is when the heart is about to contract. Heart is about to contract. At that time, whatever blood is filled inside the ventricular system, because from ventricle only blood is going to the left ventricle, only blood is going to the systemic circulation. So in left ventricle, whatever the blood is present just before contraction is preload, is end diastolic volume. Now you must be wondering then what is the meaning of preload, and this is a normal phenomena, right? Yes, this is a normal phenomena that blood will come in left ventricle and after some time left ventricle will contract and then blood will go out. But the concept over here is when the preload increases. When preload increases means the filling of blood in the left ventricle increases. And I said that filling is directly proportional to force of contraction as per the Frank Starling's law. Because of increase in preload, more blood will come to the left ventricle, and when the left ventricle contracts, there is a high force required to contract the left ventricle because of more filling, and that will be provided by the walls of myocardium. But when the heart contracts, we have ejection fraction is near about 66 to 67%. I must say to all the students who are watching this content, our normal human ejection fraction is 66 to 67%. To explain this, I am taking 70%. Just to explain, I am taking 70%. It is 60 to 65 to 67% only, but 70%. It means 100 ml blood, if 100 ml blood comes to the left ventricle, when left ventricle contracts, 70 ml blood will go out. 100 ml came, 70 go out. How much remain? 30 ml. Next time, when the filling time starts, heart will fill with the 70 ml. 70, already 30 is there in the heart. Even after contraction, left ventricle will not be empty. Even after contraction, left ventricle will have 30 ml blood. Then more 70 ml is added while the heart was in the relaxation stage, while the heart was filling. So that addition of 70 ml and 30 ml becomes 100 ml. And then again, when left ventricle contracts, 70 ml blood will go out and 30 ml will remain inside the heart. Now the condition where preload increases. If preload increases, the blood coming inside the heart will increase. So maybe it is now 120 ml. Up, it was earlier 100 ml, but preload increase. So the blood coming to the left ventricle is increased 120 ml. When the left ventricle contracts, from that 120, maybe 80 ml blood will come out, but 40 ml remain. Earlier 30 ml only remained in the heart. Here 40 ml remain even after contraction. Ejection fraction is normal here. Okay. So after contraction, 40 ml blood is remain and 80 ml blood came out. Still, 80 is more than 70. That is high. That will increase the pressure. But now 40 is remain. Again, when the heart is filled, 70 to 80 ml blood will enter. So 80 ml blood will enter and 40 is already there. It will be again 120. When it contracts, again 80, 75 will go out, and again refilling time there will be addition. So this is how there will be keep on rising in the volume coming in the left ventricle. And because of there is a keep on rising in the volume coming in the left ventricle, there is a keep on rising in the blood coming out of the left ventricle, and that is cardiac output, and that will be rise in cardiac output because of increase in preload, and that rise in cardiac output will lead to increase in systolic blood pressure as per the concept precisely explained in our video. So basically, preload is a normal concept. End diastolic volume is a normal concept terminology. But when end diastolic volume increases, it is causing a problem called increasing cardiac output by contracting more left ventricle, and by filling more with the blood and contracting more forcefully. Cardiac output is earlier 70, but now it is increased to 80, 85, 90, 95. And this rise in cardiac output will not cause any dilation in the artery. Diameter are fixed in human body. But if the volume is coming more, the pressure exerted by this blood on the blood vessel will be more, and that is why the rise in blood pressure we will be seeing. That is preload. Load of blood before contraction of the heart. That is called preload. Second is uh, maybe majorly people are confusing afterload. Afterload is a second synonym of total peripheral resistance. But afterload is what? Say we talk about initially we talk about cardiac output. What is the blood coming out of the heart? Now we are talking about where this blood will go, which came out of the heart. Heart came out of the blood came out of the heart. Sorry, slip of tongue. So I said that heart come out of the blood, but heart will not come. Heart when the blood come out, when blood will come out of the heart, where blood will go? Where blood will go to systemic circulation. Blood will go to systemic circulation via which pathway? We have discussed that pathway also in basic concept. So when the blood comes out of the heart, that goes to the arterioles and venules, and arterioles and venules are located in the vital organs, and this will supply the oxygen and nutrition. So these arterioles and venules have a narrow diameter, right? So when the blood comes from the good diameter artery to the narrow diameter arterioles, there will be some resistance offered because of the physics law, because of the change in diameter. Now, if this is also again a normal phenomena, there will be certain kind of resistance offered by the narrow diameter arterioles to the major systemic arteries. But when the afterload increases, means these arterioles become more narrow. Now, whatever resistance offered by this narrow artery to the major systemic artery is higher. So the total peripheral resistance or afterload increases. Resistance offered by these narrow arterioles to the wider arteries are called afterload. When afterload increases, this become more narrow. When this become more narrow, this wider artery flow, blood flow, which is coming, will hinder the or will provide the resistance, will hinder the normal flow, and that will keep blood for a longer period of time inside this artery, and blood cannot go back because there is a closure of aortic wall, as we had discussed earlier, that there is a closure of aortic wall, blood cannot go back. So due to that reason, blood stay for longer period of time in systemic artery, and we measure the blood pressure in brachial artery, and because of that we feel the more pressure. And even if the heart is in relaxation stage, there will be no reduction in blood pressure, and when we measure it, we measure that diastolic blood pressure is more compared to systolic blood pressure when the total peripheral resistance is increased. So I think I have tried to explain it more precisely with the simple explanation. Still, if you find any doubt, you can let us know, that we will specifically dedicatedly we will prepare a video on this topic, afterload and preload. A small video which you all can like and enjoy. Maybe you will be tired of looking at the longer videos, but sometimes it is necessary to explain the concept in a one shot rather than taking 2 to 3 shot. We can explain it in a one go. We will be taking questions now from the another participant. Hamza Postwala has asked us a question: how to get scholarship for abroad studies? Now, I must say, Hamza, he also has one more question: how to enroll in PhD program in abroad? Now, I cannot explain within 5 to 10 minutes about this, but I assure you, Hamza, that we will be posting a video where we will be discussing about the career opportunities for the Pharm.D graduates in enrolling PhD in abroad, and how to get scholarship, how to fetch the scholarship. So we will be launching a video on this, that you complete the Pharm.D in India, maybe in Pakistan or any developing nation, China, or maybe in developed nation like US, Canada. After completion of your Pharm.D, how can you approach to the developed nation or institute or a mentor, and how can you apply? What are the prerequisite? How can you apply? What are the chances of your selection? We will be discussing about this in a dedicated 10 to 15-minute video, where we will be discussing about this topic in detail. Basically, you have to create your own resume, you have to create your own research area, and then you have to find out the people working in that area. Then you have to approach them. If your research and your mentor or your guide, or maybe future guide research area and everything will match, if they think that you can contribute to their lab, and if you think that you can learn something from there and contribute as well, they will be funding you for the PhD. You can enroll, you will get stipend, you will have certain responsibility of teaching also apart from research, and this is how you can mutually collaborate and you can work. You will get the student visa, you go there, you will get some working visa after completion of your study as well. So we will be posting a dedicated video on that topic, Hamza, so you will get an very good idea. Next, we have a question from Shivam Bhagat. Good afternoon, sir. I couldn't be able to understand the equational part of mean arterial pressure you discussed in the hypertension video. Can you please explain it in detail? Uh, Thank you. Maybe while I was delivering that content, I was also feeling that mean arterial pressure concept is very important, and it is very much important for us to understand it precisely, and it is difficult to understand in a short span. So let me explain, because in that video the limitation was we need to complete the content in a 10 to 15 minutes, otherwise viewer will get bored and they will not see the video again. So I'll explain that you need to first understand the cardiac cycle. That cardiac cycle, if you understand, cardiac cycle is composed of systole and diastole. Systole is contraction, diastole is relaxation. I hope everyone is aware about it. So now cardiac cycle, when we discuss, I'm just taking you to the basic and then I'm coming back to the mean arterial pressure. So systole and diastole is two component of cardiac cycle. So I must say that you people know that 72 beats per minute is the normal heart rate, right? One heart rate, one cardiac cycle. I hope it is very clear to everyone. Now 72 beats per minute means 72 beats per 60 second. So when you divide 60 second to 72, you will get exact time for one cardiac cycle. So if you divide 72 by 60, you will get 0.8 second, right? You don't have to calculate. You can calculate. I have calculated, so I'm saying 0.8 second time heart is taking to complete one cardiac cycle. Now, as I said, cardiac cycle is composed of systole, diastole. So systole and diastole both are the component of cardiac cycle. Now we need to divide this 0.8 second into systole and diastole. So those students who are very intelligent, they know the systole is one third of cardiac cycle and diastole is two third of cardiac cycle. Systole is one third of cardiac cycle, means 33%, and diastole is 66 or 0.6%, and 33.3% is systole. One third is systole, two third is diastole. Because systole cannot stay longer, diastole can have a long duration because we need to fill the heart. Systole we need to contract the heart. So 0.8 second is a time taken for complete cardiac cycle. You divide it into systole and diastole. 0.3 second for systole, 0.5 second for diastole, right? 0.3 second for systole, 0.5 second for diastole. 0.3 plus 0.5 is equal to 0.8. So now 0.3 second, while systole is going on, what will be the blood pressure in a human body? If we take ZNC 7 guideline 120, if we take ZNC 8 guideline, normal blood pressure is up to 140. We'll take simple JNC 7 guideline right now. So when the systole, when 0.3 second, while 0.3 second, where is the systole time, human blood pressure is 120, right? After 0.3 second, 0.4, 5, 6, 7 and 8, rest of 0.5 second, blood pressure is, diastole is going on, no? So blood pressure is 80 mmHg. So for longer duration, blood pressure is 80. For shorter duration, blood pressure is 120. Now, mathematics we need to use over here, that 120 is blood pressure in 1/3 of cardiac cycle, and 80 is the blood pressure in 2/3 of the cardiac cycle. Now, if you say throughout the cardiac cycle, minimum blood pressure is 80, 80, there is no fall in blood pressure from 120, from below 80. 80 से नीचे तो ब्लड प्रेशर जाना ही नहीं वाला है. 80 is the normal baseline. So normal blood pressure is 80 throughout the cardiac cycle, but for a initial period blood pressure is more than 80, it is 120. So what is the difference is 120 minus 80 is 40, right? That 40 is only staying for 1/3 part of cardiac cycle, means for 0.3 second this 40 is staying, rest of the time blood pressure is 80. So now this 40 we need to divide with 3, because for 0.3 second it is staying, so 1/3 part. So what is the 1/3 of 40? It is 13.3 something around, we had discussed in video. Now you add that 80 which is the baseline, so you have to just take something from baseline. 80 is a baseline plus 13.3 which is 1/3 of the systole. You cannot directly add 40 into 80, because in diastolic time duration there is a blood pressure 80 only, there is no 120 blood pressure during diastole. So you just have to add 13.3 into 80, it will be around 93.3. that will be your mean arterial pressure. Let me explain again in Hindi. हमारी बॉडी में सिस्टोल और डायस्टोल दो चीजें होती है, और दोनों को कंप्लीट करने, व्हेन दिस बोथ विल बी कंप्लीटेड, इट इज कॉल्ड वन कार्डियक साइकिल. एक कार्डियक साइकिल में 0.3 सेकंड का सिस्टोल होता है और 0.5 सेकंड का डायस्टोल होता है, जब आपकी हार्ट रेट 72 बीट्स पर मिनट होती है. 72 बीट्स पर मिनट में इसलिए ले रहा हूँ बिकॉज इट इज अ नॉर्मल हार्ट रेट विच वी ऑल अंडरस्टूड व्हाइल वी आर स्टडीइंग इन एनाटॉमी फिजियोलॉजी और एनी मेडिकल कॉन्सेप्ट. अब जब आपकी हार्ट रेट 72 बीट्स है तो आपकी एक कार्डियक साइकिल कंप्लीट होने में टाइम लगेगा 0.8 सेकंड. ये 0.8 सेकंड को अगर मैं सिस्टोल और डायस्टोल में डिवाइड करूं तो 0.3 सेकंड का होगा सिस्टोल और 0.5 सेकंड का होगा डायस्टोल. 0.3 सेकंड के लिए आपका ब्लड प्रेशर रहेगा 120, 0.5 सेकंड के लिए आपका ब्लड प्रेशर रहेगा 80 एज पर जेएनसी 7 गाइडलाइन. तो आपका ब्लड प्रेशर 0.8 सेकंड तक 80 तो रहा ही है, 80 से नीचे तो गया ही नहीं है, लेकिन 0.3 सेकंड ऐसी थी जब आपका ब्लड प्रेशर 80 से बढ़ के 120 तक गया था. तो अगर मुझे वो ड्यूरेशन का डिफरेंस निकालना है तो 120 में से मैं अगर 80 निकाल दूंगा तो 40 मिलेगा ना आंसर. दैट 40 इज फॉर 0.3 सेकंड ओनली, 0.5 सेकंड के लिए तो जीरो था, तो वो 40 को मुझे अब 3 से डिवाइड करना है क्योंकि वो सिर्फ 1/3 पोर्शन के लिए रहा था. तो वो आपका आंसर आता है 13.3. वो 13.3 को आप अगर 80 जो आपका बेसलाइन था उसमें ऐड कर दोगे तो इट विल कम अराउंड 93.3, एंड दैट 93.3 इज योर मीन आर्टेरियल प्रेशर. ये आर्टेरियल प्रेशर ये होता है कि थ्रू आउट योर कार्डियक साइकिल आपका ब्लड प्रेशर कितना रहता है, राइट. सो दिस इज हाउ वी हैड डिस्कस मीन आर्टेरियल प्रेशर इन अवर प्रीवियस वीडियो. आपको कंफ्यूजन इसलिए हो रहा है क्योंकि हमने ऐसा लिखा था कि 1/3 multiply with the systolic blood pressure plus 1/3 2/3 multiplied with the diastolic blood pressure. It is an equation, but if you want to understand that, in this equation which I have mentioned in the video, it is given in DPRO also, it is given in Erfindal also, it is given in Kodak Kimball also, it is given in Google also. You can find that equation anywhere. You just have to understand the concept of cardiac cycle. You just have to understand the concept of calculating one cardiac cycle, how I have get the value 0.8 second. You have to understand that 72 बीट्स अगर मैं ले रहा हूँ तो वो कैसे ले रहा हूँ, क्योंकि वो नॉर्मल हार्ट रेट है. वो 72 बीट्स को मैंने कैसे 0.8 सेकंड में 72 को मैंने कैसे उसका ड्यूरेशन निकालने, एक कार्डियक साइकिल का ड्यूरेशन निकालने के लिए यूज किया कि 60 सेकंड में अगर 72 बीट्स होती है तो एक सेकंड में कितना होगा, राइट. सो वो आपको कैलकुलेट करने के लिए 60 से 70 को डिवाइड करना है और 0.8 सेकंड मिल रहा है और उसको फिर कार्डियक साइकिल के कॉन्सेप्ट के साथ ऐड कर देना. दैट विल गिव यू एन आइडिया अबाउट मीन आर्टेरियल प्रेशर. I hope I got the message from Shivam that he understood it clearly. So we move forward to Sushti Patel question. She is asking, sir, can you explain more in detail on pressure sensitizing device cell present in the nephrons and the juxta glomerulus apparatus mechanism? Well, very good question asked by the Srushti, and I must say that you have seen the Renin video where you have seen the concept of pressure sensitizing device. Now, in kidney, we have two kidney. In one kidney, as I said, there is 1.2 million nephron. So in two kidney, there is 2.4 million nephrons are present. These 2.4 million nephrons are having pressure sensitizing device cell in each and every nephron. Each and every nephron. So when how this nephron will be sensitizing fall in pressure when the afferent arterioles is the arterioles which is carrying blood from the arteries to the kidney, and efferent arterioles are the arterioles which is taking blood from the kidney. So this will be leaving the blood, this is the entering the blood. Afferent arterioles is facilitating the entry of blood in the kidney. Afferent arterioles is facilitating the elimination of the blood from the kidney. So this nephrons are having pressure sensitizing device cells which is known as baroreceptor, which is present in the initial part of afferent arterioles where from where the blood is coming. So if there is a fall in blood pressure, maybe because of any reason, heart is failed, there is a contraction of arterioles, there is something else which is going on. If there is a fall in pressure in the afferent arterioles, there will be sensitization of that fall by the baroreceptor which is present in the each and every nephron. That is known as baroreceptor, and that is precisely known as Pulkyson cells, which is present in the afferent arterioles, starting part of the afferent arterioles. There is a fall in blood pressure, it will be sensitized by that, and these Pulkyson cells will release the renin into the systemic circulation to increase the blood flow to the kidney. I hope you are very precisely seen that video. This is the baroreceptors which is present in the nephron, which is known as Pulkyson cells. Pulkyson cells are also known as blood pressure sensitizing device cell. Device is the word used for the combination of cell. So when I use pressure sensitizing device, I am referring the bunch of Pulkyson cells, the bunch of baroreceptors which is present in the afferent arterioles, and afferent arterioles is the arterioles which is taking the blood from the systemic circulation to the kidney. So now once you understand this concept, there is another blood pressure sensitizing device cells are present in the carotid sinus, which is present near to the aorta. After completion of aorta, when there is a starting of major systemic artery, they are present over there. So fall in blood pressure because of low preload or because of low contractility or because of low force of contraction will be sensitized by the carotid sinus, where also there is a presence of baroreceptor. The name baroreceptor is because of the concept they are pressure sensitizing device. Baroreceptor means they are sensitizing the change in pressure. If it is higher also they will be sensing, if it is lower also they will be sensing. So baroreceptor is the word came from pressure given to those cells which is sensitizing the pressure, fall or rise. So carotid sinus is having baroreceptors, and Pulkyson cells is having baroreceptor, and these are known as blood pressure sensitizing device, and devices means bunch of cells. Second query is how juxta she has a query related to juxta glomerular apparatus mechanism. So yes, I if you have seen videos, maybe you have seen so many things like renin is released from the juxta glomerulus apparatus. Now if you see what is apparatus word is used because there is no one specific cells involved for the release of renin. There is a combination of some cells and system involved in the releasing of renin. We had discussed in our video there is 4 mechanism, in which 2 mechanism is intrarenal mechanism, where 3 mechanism are intrarenal. If we say the beta 1 receptor mechanism as well, Pulcison cells are present in the afferent arterioles, and macula densa cell are present in the initial part of distal convoluted tubule. So if you see the nephron, afferent arterioles is present near the glomerulus, initial part of nephron, and distal convoluted tubule is the last part of nephron. About before collecting duct, it will come the distal collecting tubule. Initial part of that contains macula densa, dense cells. So these are connected with the connective tissue, and because Pulcison cells and macula densa cells are connected with the connecting tissue, they both are connected. It is known as juxtaglomerular apparatus, because Pulcison cell will also release renin. They also sensitize the fall in blood pressure, and macula densa is sodium sensitizing device. They sense the fall in sodium concentration, and then they release the renin. Both will release the renin. One release the renin based on the pressure sensitization, and one will release the renin based on the sodium concentration. So when I discussed this precisely in video, when pressure blood coming to the nephrons will fall, reabsorption of sodium will be higher, so the concentration of sodium reaching to the distal convoluted tubule is lower. So that will be sensed by macula densa, and that will help that will be responsible for releasing renin into the blood circulation. This is called juxtaglomerular apparatus. People are often confused because in books it is written macula densa signal, there will be releasing renin. But where is macula densa? How it is releasing renin? Against what concept it is releasing renin? It is not clearly given in any book. Second is Pulcison cells related mechanism, or words maybe you will be hearing for the first time. It is a simple receptor. It is simple smooth muscle, modified smooth muscle, which is having baroreceptor, falls in blood pressure, and releasing renin into the blood. So this is a simple concept of juxtaglomerular apparatus, combining the baroreceptor, Pulcison cells, and macula densa cells, which is sodium sensitizing cells, and combine release the renin. And direct mechanism is when the norepinephrine releases, it binds to the beta 1 receptor present in the this juxtaglomerular apparatus and directly release the renin. These are the 3 different mechanisms, apart from one uh, systemic mechanism where there is a fall in serum electrolytes, then that leads to release in renin. So I hope I have covered your query, Srushti. I must say that I don't have any other queries up to the videos which we have launched. So we have live chat box. We will be discussing the queries which will be arise during this discussion, or maybe of the previous video which we have launched, or maybe in future what few things you need to your expectations from us, what you want from us, what kind of content you want to deliver by our channel. You can let us know in the live chat. We had let me recapitalize everything that we have discussed about the clinical fellowships related query. We had discussed about the queries related to PEBC syllabus, books, what you can refer. We had discussed the query related to PhD. We have not discussed that in detail, but we will be launching a video that how you can enroll in abroad for PhD along with the fund after completion of Pharm.D, B.Pharm, M.Pharm, any pharmacy graduates. We had discussed about the mean arterial pressure. We had discussed about the preload and afterload concept. We had discussed about the juxtaglomerular apparatus and its mechanism, bit of its mechanism. We had also discussed about the miscellaneous content, where the queries were related to what kind of materials you have to use. For example, I must say that I have left that query. One person has asked that what material do you use to prepare those videos you have launched. So basically, it is a combination of so many reference and textbooks, as well as some clinical experiences what I am having, and some postmortem I have seen, where I have learned some organ physiology. As physiology, we cannot learn from the dissection, but we can learn some anatomical structures and all kind of things during my postings, as well as my clinical experiences. So I will be compiling those information, and I will be trying to reach to the students with the very ease that I'll explain the concept with very ease that people will understand it rather than mugging up and take a maximum advantage out of it. So I wait for the 1 or 2 minutes. If someone has any kind of query, you can inform or you can write us in the live chat, which I will be continuously looking at. And you can also write to our email, which we have mentioned in all the videos. You can reach out to us to our social media handles. We have our social media handles like Instagram, uh, Twitter, Facebook. Anywhere you can reach to us, you can post your queries, you can help us to improve the content which we are delivering. You are facing any difficulty while watching our videos, you can let us know. We positively take the suggestion and we will try to improve on it. Our email address is mentioned in the, I hope you will be all be seeing the comment box, khadela.academy@gmail.com. You can write it to this email address. Now, basically, I must say that we will be launching our videos periodically, and we are trying to launch the videos which will be synchronized with the previous videos. So we request you that when you go to the next video, you must refer to the previous video if the duration is long. I must say that if you have studied a basic concept of hypertension, and then maybe because of some commitment, we will be launching the video later. You please refer that video again and then look at the another video so that there will be continuous flow you will be maintaining of the information you will be grasping. And that will help you to reach to a certain level where you can understand the concept very precisely. Second is, whenever you will be studying, you please try to correlate the things with the knowledge what you already have. So when we discuss about juxtaglomeralis apparatus, you are the student who already have studied juxtaglomeralis apparatus. So try to synchronize the knowledge what you have and what we have delivered, and then correct where it is missing. Don't try to replace it completely. Try to refill it. A very good advertise I have seen recently, where they have mentioned that अगर कोई चीज बिगड़ जाती है तो उसको पहले रिपेयर करो, अगर रिपेयर नहीं हो सकती है then you replace it. So try to repair your knowledge with our videos. Don't try to replace your knowledge with our videos. Try to understand the hard work and dedication of the teachers who have taught you the concept earlier. Don't try to replace everything and don't try to overjudge any person, but try to understand our videos where we will be delivering a concept rather than we will be delivering you a knowledge which you will mug up and you will deliver it in the exam. I must say that whatever knowledge you will be gaining through these videos will help you in the clinical practice rather than in the exams what you will be definitely it is a win-win situation. You can write it in exam, no one will say that this is not true, but the knowledge which we are providing is to reach to the patient. We need to uplift the patient care in India or in any developing nation or in developed nation. In order to uplift that, we need to strengthen our roots, and our roots are our fundamentals. If our fundamentals are poor, maybe we will succeed in a shorter span, but we will not succeed in a future. So I advise to those people who want to pursue a career in the clinical field and who are having a direct interest in this field, they can pursue a knowledge by heart and not by just mugging the things. So try to connect with us with the videos we will be launching. Try to watch the full video. I'm not saying that you watch the full video and we will be getting some of the benefit out of it. I'm saying you watch the full video to understand the concept fully. Sometimes we are in a hurry. I request you that if you have time, if you see the duration of video is 30 minutes, you don't have time for that continuously, you don't have time because of some commitment to sit and watch the video. you don't see at that time. You please spare some time. When you get time, you sit and you watch the full video and try to understand the concept fully, and then you can do your activity, rather than seeing the video for 5 minutes, then for 5 minutes after some time. Second option I can give it to some advanced student is, you can increase the speed of the video using tool given in the YouTube, which is I'm using for sometimes when I'm learning from some good teachers. You can increase the speed and you can finish it the 30-minute video into 15 minute or 20 minutes. You can increase the speed. You maybe you are a very good student, you already knew some concept, you don't have to wait and you don't have to re-listen everything. You just forward it very fully with the high speed, and then you watch it 30-minute video in 15 minutes or maybe 10 minutes. But whenever you watch the video, watch fully. Maybe some I'm not keeping any information at the end to retain my audience, but I'm keeping all the information, uh, important information throughout the video, so that you will get all the sufficient information related to the topic. Second, I must say that we will be launching a video of one disease, multiple videos, and there will be so much content for one disease. The purpose is that you master the disease. The purpose is not to complete the syllabus. This channel is not just to clear the exams. This syllabus is to clear the concept and to deliver to the medical care, to the clinical practices. So I must say that the aim is just to reach to the underprivileged student as well as to reach to the patient also. So many patients are misdiagnosed, so many patients are not getting optimal care, so many patients are having complications, so many patients are having adverse event. You understand the concept, you understand this disease physiology, and try to deliver it to the uh, patients. And when we have a very sufficient knowledge, I must say that when you have a good knowledge of a disease, when you have good knowledge of a therapy, your confidence will increase. When your confidence will increase, I'm not talking about overconfidence, I'm just talking about a confidence. When your confidence will increase, you will very precisely able to communicate to the medical team, healthcare professional team, MD, MBBS, with the so much confidence, where they will once you deliver the content, they will also appreciate if the content what you have delivered is true and helped physician to get a better patient care. So this is what the purpose of our learning therapeutics and delivering it. Because when we learn therapeutics, we try to learn the concept of implementation of medications to the patient's life. And when we are administering some drug to the patient, it is our prime responsibility to maintain the safety and efficacy. And to do that better, to rationally use the medicine, we should have our fundamentals clear. And I hope this will be cleared through all the videos what we will be launching. You try to watch the video fully, give us the feedback, and try to understand the concept. We will be having this question answer session, ask me anything sessions periodically, where you can interact with me live, where you have any doubt, silly doubt also, we will be discussing about that. So I hope it is served the purpose, and people who have sent their questions, I have tried to deliver. We will be ending this question answer session now, because I have not seen any new or fresh query in our live chat. So thank you so much. If you have not subscribed the channel, please subscribe, share the videos and content if you like, and share the feedback of any videos, whether it is positive or negative. We will welcome the feedback from the viewers. Thank you so much. Keep watching, keep learning, and keep progressing.